Bladder pain syndrome, or interstitial cystitis, I'm just going to call it IC from now on, is its own monster in itself. For me, IC was one of the most annoying symptoms that I had because it literally feels like a UTI. The worst time for me was actually at night because you're trying to go to sleep and you just can't. I would have to wake up, I would go and sit in the bath in like a really like low amount of like extremely hot water, and I would just sit there and that would help. But of course, immediately after I get out of the bath, the pain returns. And I'm very cautious to call it pain because it wasn't necessarily pain. It was like this itchiness, and this itchiness that makes you feel like you need to use the bathroom, which is even more annoying in many ways than pain, at least for me, because you know that you just went, but you can't focus on anything else. It felt like someone was just kind of scratching at my lower urethra, just like it was this terrible like little paper cut, a burning, stinging, just a terrible feeling. I couldn't get anything done, needing to go to the bathroom every 30 minutes, completely unable to sleep, focus, or do anything. I was really out of options. And so what I would do is I would take Azo, which is that pill that turns your underwear and urine orange. And that would kind of help, but not really. I did all the cranberry things. I cut out foods, which did help a little bit. Caffeine and alcohol definitely were triggers for me. But regardless of even cutting those foods out, I would still have this pain. Stress was definitely one of my triggers. I would notice that when I had something that was causing me to be in this fight or flight, emotional hypervigilance, something was going on in my life that was causing me distress, my body was like, how about we make it worse? Here's some quotes from actual women who have bladder pain syndrome. My urologist said, my bladder looks like it has 500 paper cuts inside of it. And that's exactly how it feels. Yeah. It feels like acid is hitting the walls of my bladder constantly, and sometimes it's itchy on the inside. Peeing is miserable, and not peeing is miserable. I feel like I had little people inside my bladder stabbing me with knives. Plus all the classic UTI symptoms, but the tests always come back negative. The pain is this sharp and pinchy, burning, searing feeling, but also a dull, heavy ache sitting in my lower abdomen like a brick. It feels like my bladder is full of broken glass and someone is squeezing it every time I try to hold my pee, even a little. So bladder is basically a stretchy bag that fills up with urine. And usually when it stretches and fills, women don't feel it, right? But in bladder pain syndrome, that filling process becomes painful. And when this occurs, the only way to get the pain to stop is to empty your bladder. But of course, that only helps for a tiny bit, and then the cycle continues again and again. Surprisingly enough, this condition affects women 4 to 5 times more than men. And usually when women have bladder pain syndrome or IC, it follows along with other conditions as well, such as endometriosis, migraines, fibromyalgia, and our favorite, IBS. So women have this constant, immense urge to urinate all the time, and it feels stinging and stabbing and grating and an aching. And women can be going to the bathroom 20, 30, even 60 times a day. And how can you get anything done in your life when you're living with a condition like this? You can't. So there isn't just one reason why bladder pain syndrome exists and starts to occur. There's actually a bunch of different reasons, but here's what the science has really distilled down to the main things. Number 1, the bladder's protective coating breaks down. Think of like a nonstick pan, for example, how it has that protective coating. Our bladders have the same exact thing as well. And this breaks down. And when that occurs, it allows harsh chemicals to then attack and seep through and cause pain. Reason number 2 is your immune system. So mast cells, which are the same cells that work with your allergies, they pile up in the bladder wall, sometimes even 6 to 8 times more than normal. And then these cells release histamine and other chemicals that irritate the lining and, once again, cause pain. Basically, it's sort of akin to having an allergic reaction, but inside of your bladder. Reason number 3, the nerves themselves become hypersensitive. So this is called peripheral sensitization. And that's when the localized nerves start sending pain signals when they actually should not be. So normally when the bladder fills, there are no sensations sent to your brain saying, hey, this is something that we should be worried about. But with peripheral sensitization, just because you've had those pain signals over time, your body starts sending signals of pain even when it shouldn't. A bladder that's filling normally starts to have pain. Reason number 4, central sensitization. Basically, the volume knob on pain gets turned up. So after months or years of constant pain signals from the bladder, your brain actually starts sending those signals and amplifying them. In studies on bladder pain patients, this is a super common finding. Reason number 5, oxidative stress or otherwise having cellular damage. So oxidative stress or damage from free radicals basically causes inflammation, it disrupts normal function, and this creates a vicious cycle of damage and pain. It can be super difficult for patients to know, do I have bladder pain syndrome, aka IC, or do I have endometriosis? I really don't know. And the truth is, a lot of times they co-occur. So the uterus, bladder, and the bowel all share the same nerve pathways. And so having issues with one of them can cause issues in another. So if you're having pain signals being sent from the uterus, that can sensitize the nerves from your bladder as well. This is called visceral cross-sensitization. And very easily stated, this just means pain in one organ can cause pain in another. Okay, so you have bladder pain syndrome and you're like, awesome, great. Okay, what do I do about it now? So here's some things you can try. Try identifying food triggers, things like coffee, tea, alcohol, citrus, spicy foods. These things can cause more pain in some women. Managing stress. I know stress can be really annoying and hard to deal with. I know for me, that was my main trigger, unfortunately. Managing it and releasing your emotions and dealing with your trauma and avoiding situations that are bad for you, being more authentic, those things do help. Pelvic floor physical therapy is actually one of the things you can do as well that can really help with bladder pain. Make sure you avoid Kegels though, because Kegels can make it worse. So if anyone's telling you to do Kegels, don't listen to them. Learning to relax those muscles in addition to trigger point therapy, manual release techniques, those things are what actually move the needle. And if you can find a pelvic floor physical therapist to do this with you, it's going to make things a lot simpler. There's also medications that can help as well. Things like amitriptyline, antihistamines, gabapentin, even tadalafil is being studied for helping with bladder pain syndrome. I want to explain for a second, the emotional toll that having this causes a woman. Women are way more likely to have depression, and when they look at quality of life surveys, this exceeds arthritis and is on par with many cancers. Because imagine it. You're running to the bathroom all the time. You can't think about anything else. You can't live your life. If you have bladder pain, that's kind of where everything is. It's all about that. No one who has this should suffer in silence or be told by a provider, we don't really know what to do with you. Or women deserve to be treated with respect, and they deserve to have this taken seriously, because it is one of the most debilitating things out there, and there are definitely things that you can do.